The Census Bureau estimates there are about 350 languages spoken in the United States. The Seattle metro area has 166 languages spoken at home, with over 22% of residents having English as their second language. Medical interpreters are needed in healthcare facilities in order to translate important information such as test results, treatment options, and an accurate patient history. If a patient does not speak English, then true informed consent cannot be obtained until proper translation is completed. Many studies have shown that adverse events occurred more frequently among patients with limited proficiency in English than among those who were proficient in English. Language barriers have led to many issues between healthcare workers and patients, like miscommunication, reduced care quality, delayed inpatient care, and decreased patient satisfaction. Clinics and hospitals throughout the U.S. and Canada are adopting the use of translation services called digital medical interpreters, or interpreters on wheels. Digital medical interpreters are used in two ways. One is an app-based interpreter, and the other is by connecting with an interpreter over video chat that speaks the language of the patient and can translate medical information correctly. There are many digital applications available for translations in hospitals. One of the apps, called Medibabble, assists in taking a medical history and performing an assessment with non-English speaking patients. This app has a list of clinical questions and instructions organized by systems and symptoms. The Medibabble translates to 5 languages, including Spanish, Cantonese, Mandarin, and Haitian. Another app, called Canopy Apps, translates to 20 different languages using the same operations. Many other apps, including Verbal Care, Speaks and Translate, and iTranslate, translate to 50 or more languages. All healthcare providers need to do is select the language, state the question, and await for the translation. LanguageLine is an example of a company that does web-based interpreter service, often used as a tablet on a cart that can be wheeled around. It connects the healthcare provider and the patient to an interpreter over video chat that can translate for the patient. The healthcare provider selects the language, waits for an interpreter, and when they're ready, states the message to the interpreter and awaits their translation. These digital medical interpreters have shown to reduce the number of patients who rely on family to help translate during doctor's appointments or hospital visits. That fact alone helps maintain the patient's privacy. Patients can opt to turn off video while using digital medical interpreters, which helps maintain the privacy and dignity of the patient. Digital medical interpreters have been shown to improve the overall quality of the healthcare experience for the patient and reduce health inequities associated with being a non-English speaker.